As you are all aware, a lack of a mask mandate has created a lot of anxiety amongst especially teachers and parents. Do you believe that the policy shift that was announced today will ease that anxiety? And why did it take so long to put in these measures around masks, considering this is something that has been called on now for more than 5 months?
Well, thanks for that question, Richard. And of course, it's very important for all of us that students, their families, and staff feel confident with the safety measures that we have in place. And throughout the pandemic, we have been meeting regularly with our education partners and provincial health officials through our provincial steering committee. And we've certainly been learning as the pandemic has unfolded. We've been learning about the behavior of the virus, and we've been learning what's been working and what hasn't been working in our schools. These K-12 revised K-12 guidelines that we're announcing today are meant to be consistent with the new CDC guidelines. And I would point out as well that we, in fact, have required that students in the upper grades wear masks in areas where the risk is elevated, in areas of schools where the interactions are not controlled, and that has been an important measure. So that this measure today is extending that measure now into learning spaces and into their learning cohorts. And perhaps Dr. Henry, if you,
you have a follow-up, Richard?
Just to the point of, do you expect this to alleviate the anxiety that many have felt? And can you explain, Dr. Henry, the science behind not requiring any student to wear a mask while sitting at a desk in a classroom, even in some cases where physical distancing is not possible because of the size of the classroom?
Richard, I'll just address the anxiety question. Sorry, I apologize. I missed that part of your earlier question. I do want to say that we have, and I know that school districts in particular, and those who are really in the schools every day, have been very attentive to responding to the anxiety that we're all feeling. I mean, we are living through an unprecedented global pandemic. There is absolutely anxiety amongst students and staff and their families in schools and across our communities. And it certainly is my hope that the work that we have done together collectively over many months around the safety plans, but in terms of these revisions, very many intense weeks since we returned after the in early January, that this does go some way to making folks feel more secure and confident. And I'll just ask Dr. Henry on the second part.
Yeah, so as we know, there are many different parts of the safety plans in schools, as we have in every other place. And we are not seeing transmission when students, teachers are in the classroom sitting at their desks. We know as well that it's a challenge for young people to wear a mask all the time. For some of them, it's impossible. So it gives people an opportunity when they are in a low-risk setting. And we have to remember, schools continue to be a low-risk and safe setting. So there are many other measures that make it safe to make sure that you have opportunities when children and young people are sitting at their desk, when they're doing work at their workstation, regardless of the exact amount of space they have around them. Those are not high-risk situations, and those are not where we're seeing transmission in classrooms, and it is aligned with what we are doing in every other sector. And I will say as well that, you know, we are learning, and young people are learning how to wear a mask appropriately, how to take it on, put it on and take it off appropriately. It's more challenging for young people, and it's all of us that need to encourage and make mask wearing part of the normal aspects of our school, but we should not be shaming and blaming either children who are wearing masks or not wearing masks. And we need to make sure that we have an environment that is healthy and safe for all children and the adults in our school system as well. So this is something that has been a progression. We've been supporting that attitude in classrooms from the very beginning, and it is working. It's effective. It's one of the measures that is effective.
Nick.
I just want to add something quickly too about the level of anxiety. I do want to remind folks that we have over 90% of our students back in class full time, and we don't hear those stories. So we do know, to Minister Whiteside's point, that there is anxiety out there, but I think we also need to start talking about the fact that we have 90% of students, approximately, back in classroom full time, having face-to-face instruction and receiving all the services that education and full-time face-to-face instruction provides them. So we do have a number of families who are feeling okay sending their kids back to school, and we're really grateful for that honor that they give to us every single day.